I'm a radiation oncologist, so the studies that I'll focus on are a little bit more radiation oncology focused as well. So to me, kind of the key highlights of this year's studies, the main one was in the hepatobiliary session, which was Dr. Dawson discussing the NRG RTOG 1112 study, which was looking at patients who had hepatocellular carcinoma who were not candidates for other therapies, and was looking at the role of radiation incorporated into their treatment. And this is a long-awaited study result. And I think the key thing from this study is it does show that for patients that are getting sorafenib, that the radiation in addition to sorafenib improves overall survival. The second study that I think is noteworthy was also a hepatobiliary study as well, also presented by Dr. Dawson, that was looking at the role of palliative radiotherapy in patients that have significant either primary liver cancer or metastatic disease to the liver, and the potential benefit that that palliative radiotherapy provides in terms of patient-reported outcomes and quality of life. And then the third abstract that I'll highlight was in the lower GI session in rectal cancer. And it was a study out of Memorial Sloan Kettering that was looking at the time of COVID, there was sort of a transition in practice patterns where they started doing a lot more short course radiation. And it was looking at their outcomes in terms of complete response for rectal cancer in particular, with a short course when they compared patients that were treated during a COVID time period where they all received short course radiation versus prior to and after that, where they transitioned back to a long course chemoradiation approach. And what they saw was that there was a higher rate of clinical complete response as well as organ preservation in those patients who got long course chemoradiation.